Hello students, welcome to Lazy Tutor where you can learn nursing simply. Today we're going to study about pelvis, especially the female pelvis, its functions, its bones, ligaments and joints. So first of all, what is a pelvis? It is a basin-shaped cavity which connects the upper body and the lower body. It has a complex of bones. It contains bladder, rectum, and internal reproductive organs inside this cavity. It has these essential organs. The function of this pelvis is it helps in the movement of the body and it supports the weight of sitting body to the ischial tuberosity. So this thick lower part is called ischial tuberosity. This over here, this thick lower part is ischial tuberosity. So these are about the female pelvis. Now we're going to study the pelvic bones. There are two innominative bones, one sacrum, and below the sacrum there is coccyx. So these are the three parts in the pelvic bones. Next, we are going to further study about the innominative bones. So, innominative bones, this innominative bone has again three parts are there. This large flared out part is ilium, this lower part is ischium, and the middle part is pubis. So, these are the three parts in innominative bones. So now we are going to study about the ilium. So ilium is the large flared out part. Thus, this large flared out part is ilium. Over there also ilium are there, this large flared out part. And while we are placing our hands on hips, it is directly we are placing onto this iliac crust. So this is iliac crust. And there are two types of bony prominence are there in the front and the back of this iliac crest. They are called this iliac spine. So iliac spine, the anteriorly there are two iliac spines are there, anterior superior iliac spine. Wait a second. Okay, anterior superior iliac spine and anterior inferior iliac spine. So these are the two spines which we see anteriorly in front of this iliac crest, and posteriorly there are again two spines are there, posterior superior iliac spine and posterior inferior iliac spine. These are the two iliac spines which we see posteriorly. Another bone in innominative bones, another part of innominative bones is ischium. This orange colored part over here, it denotes ischium. So ischium is the thick lower part in this innominative bones. It has a large prominence which is the ischial tuberosity. So this large part is ischial tuberosity, and behind to this and behind to the ischium, a little above the ischial tuberosity, there is an inward projection which is called ischial spine. This is called ischial spine. Okay, these are, and in labor, during labor, the station of head is determined in relation with this ischial spine. So in relation to this ischial spine, we will determine where the fetus head has been reached during labor. The part in this innominative bones is pubis. This is the last part. So this green area is pubis. So pubis is the anterior part and it has a body. This is the body, and two sets of rami are there. This rami are superior rami, and this is superior rami, and this is inferior rami. And two inferior rami forms a pubic arch. So these are all about our pubis. So next we are going to learn about this obturator foramen and acetabulum. So obturator foramen is this area or this cavity which is enclosed by the body, the rami and the ischium. So this body ramen and ischium forms a cavity which is called obturator foramen, and this is this part over here is acetabulum, in which the femur head is attached to the innominative bones of this cavity is called acetabulum. And next we will learn that we can see two curves are there. This is one curve and this is another curve. This curve is a big curve comparing to this lower one. So this curve is called greater sciatic notch. So this curve is called greater sciatic notch, and the lower one is called lesser sciatic notch. Greater sciatic notch extends from the posterior inferior, you can clearly see, extends from the posterior inferior iliac spine to the ischial spine, and the lesser sciatic notch extends from the ischial tuberosity. This is ischial tuberosity. So ischial tuberosity to the spine. So this curve is lesser sciatic notch. So that was all about the parts in innominative bone. Next, we are moving on to learn the other parts in the pelvic bone, which the rest of the pelvic bones, apart from the innominative bones, they are the sacrum and coccyx. So the first is sacrum. So sacrum is a wedge shape. We can clearly see it is a wedge shaped bone. It consists of 5 fused vertebrae. So this S1, S2, S3, S4, S5. These 5 fused vertebrae are there in the sacrum. The upper border of the first sacrum. So this is the upper border. So the upper border of the first sacral vertebrae is called a sacral promontory, and this concave anterior part, this concave anterior part or this concave anterior surface is called the hollow of the sacrum, and these two things are called the wings of ala or the sacral ala. 4 pairs of holes are there. These 4 pairs of holes are called sacral foramina, in which the nerves and quadra equina passes through. The posterior surface, see, the posterior surface of this sacrum is rough in texture, which why this has a rough in texture? Because there is an attachment of muscles are there. That's why it is rough in texture. And the last pelvic bone is coccyx. So this coccyx is also called tailbone. This is the last part in, or the part which is below the sacrum. Next we will see the pelvic joints and the pelvic ligaments. So first is pelvic joints. So there are 3 types of pelvic joints are there. The first one is symphysis pubis, and wait a second. Yeah, this is symphysis pubis, where 2 pubic bones are attached or joined. This is symphysis pubis, and 2 sacroiliac joint, where sacrum and ilium are joined, and 1 sacrococcygeal joint, in which the sacrum is joined to the coccyx. So these are the 3 joints in the pelvis, and the last topic we are going to look for today is the pelvic ligaments. So pelvic ligament, there are 5 types of pelvic ligaments are there. 5 types of ligaments are there. The first one is sacroiliac joint, in the ligament which extends from the sacrum to ilium. So this is sacroiliac ligament, and next is the sacrotuberous ligament, which is extends from the sacrum to the ischial tuberosity. Another ligament is the sacrospinous, which extends from the sacrum to the ischial spine. Another ligament is sacrococcygeal, which extends from the sacrum to the coccyx. And the last one is interpubic, which is seen in between the pubic. So these are all about our pelvis. So today we have studied or learned about what is a pelvis, its shape, what it contains inside the pelvis, what all are there in the pelvis, the functions of our pelvis. The 2 functions are there. Then the pelvic bones, 3 parts are there in this pelvic bone, which is 2 innominative bones, 1 sacrum and coccyx. Then the innominative bones, which are of again three parts, which is ilium, ischium, and pubis. We have seen what is ilium, ischium, and pubis, the bones in these three, what are the parts of these three bones. Then again the sacrum and coccyx, then the pelvic joints and pelvic ligaments. So thank you for listening to that. Hope you understand this class, and if you have any doubts or queries, please do mention it in the comments. Thank you.